Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM from Houston, Texas. This is the COVID 19 Pandemic 2021 World News. Vaccines, variants, and Wave 3. Let's talk about vaccines. Even though 6 different types of vaccines are available in various parts of the world, still the number of people who have received vaccination is a fraction of the world population. Israel leads in terms of vaccination, where 50% or more have already received the 2 doses of Pfizer BioNTech vaccine. Following that, United Arab Emirates has 71% of the population which has received the vaccine. British 41% has received the first dose, where only 2.6% population has received both doses. United States, only 34 out of 100 people have received the vaccination, and only 12% of the US population has received both doses of COVID vaccine. So that is the overall picture of the vaccine, and there's still a lot of ground to be covered, which leaves like 90% of the world population still not covered by vaccine. And that's one reason we feel this pandemic is far from over. And here's a chart showing there's been a dramatic drop in the number of active cases, in the number of hospitalizations, in the number of deaths related to COVID as we enter the tail end of wave 2. As you can see, in the United States, the death rates were something like 10 per million residents. It has come down to less than 5 per million population. In Britain, the numbers were much higher, close to like 18, 19. Now these numbers are below 3 to 4 per million population. So there has been a tremendous progress made in containing the second wave of this coronavirus pandemic, but still we have a lot of things to be done, especially with reference to vaccination, to bring this pandemic under control. In Britain, they have adopted a totally different approach in terms of vaccinating people. As I showed you in the previous table, they have used the first dose in as many people as they can, and it is based on the premises that it would maximize the number of people who receive the one jab, as the British call it. They have delayed the second dose by as much as 3 months. Their concept is it is better to protect everybody rather than a small number of people who are going to get the extra 10% benefit from the second dose. Actually, the Pfizer, BioNTech, and Moderna vaccines showed the protection with the first dose was ranging from 60 to 70%. But with the second dose, the protection rises all the way to 94 to 95%. So the differences do make a difference, but nonetheless, if you can protect 60% of a larger population from a public health perspective, that may be quite effective. And in fact, in Britain, they have shown this to be effective in reducing the new cases, reducing the hospitalizations, and reducing mortality. While we are talking about combating, while we are talking about the second wave coming towards an end, while we are talking about increased use of vaccine all across the globe, in America, in Europe, in Russia, and in Asia, there is another new problem that is brewing in different parts of the world. For example, Germany, after having successfully dealt with the second wave of the coronavirus pandemic, is now experiencing a third wave surge as we speak. In the 3 weeks of March, the numbers have been slowly creeping up to a tune of almost 18 to 20,000 new cases per day. This is in Germany. In Brazil, we had a pretty significant first wave, and that was followed by a second wave, which barely even started recovering, and now it is experiencing a third wave with more than 75 to 90,000 new cases per day. And similarly in India, which had like a monolithic one wave, which India was able to successfully bring it down to a tune of 10,000 new cases compared to 100,000 new cases back in September 2020, is experiencing a second rise in the number of new cases, all the way up to like 30 to 40,000, especially in major cities like Hyderabad, Bangalore, New Delhi, Mumbai, where there is a sudden surge in the number of new cases, which are posing a new challenge and a threat to the healthcare officials who are trying to vaccinate as many people as they can in a race against containing this pandemic. Okay, coming back to this chart, Israel is the only country which had more than 50% of its population who have received both doses of the vaccine. In case of Johnson & Johnson, you just need to receive one dose, but again, the effectiveness of a Johnson & Johnson vaccine is around 62 to 70%, depending upon different parts of the world. In Britain, as you can see, only 2.6% of the total population has received 2 doses, whereas 38% has received at least 1 dose. And their approach seems to have worked in terms of public health policy in reducing the overall population exposure. In the United States, we have approximately 12% of the people who have received the vaccination. About 22% have received the first dose, and about maybe 10% of the population had the COVID infection. So we are talking about only at the best 20% of the population that has been fully protected against the normal corona variant. And that brings us to the topic of new corona variants and how they changed the course of this COVID-19 pandemic. There are 3 different types of coronavirus variants that are circulating here in the United States at the present time, namely the UK one, which is B.1.1.7, and it is supposed to be, the currently available vaccines are supposed to be protective against the UK variant, even though we know that the UK variant can spread quite rapidly in population. The South African variant, which causes more severe illness, has been found to be spreading the disease in various parts of the world, and the AstraZeneca vaccine doesn't seem to be as effective in preventing the South African variant. There is a third variant which is much more troubling, as we saw from the chart, where the population exposure is just skyrocketing, is the Brazil variant, namely P1, and we still need to learn a lot about these variants and whether the vaccines have to be redesigned, re-engineered to address these coronavirus variants. So, ladies and gentlemen, we still have a lot of unanswered questions when it comes to coronavirus variants. Do these viruses spread more easily from person to person? We know the UK variant spreads very easily and quickly from person to person, cause milder or more severe disease in people. We know the South African virus causes more severe symptoms in patients with the infection. Are they detected by the currently available viral tests? Yes, I think most of them are detected by the currently available virus testing devices, but as the variants become more and more mutant, we may have to adapt new testing modalities. And again, the antibodies, the monoclonal antibodies, and other types of treatments that are available, are they effective against these coronavirus variants? We don't have answers for all those things. And we have to change the vaccine formulation to address these multiple coronavirus variants. So, ladies and gentlemen, Until we have answers to these questions, the simplest approach is we only can save our lives. So the masks should continue for the foreseeable future until a large population has had received the vaccination, until we have a control over these coronavirus variants. Social distancing must be applied whenever possible so that we minimize the exposure to the coronavirus and coronavirus variants. We may be protect you, but as the spring and summer comes, the younger population may get restless and they may go outside and get exposed to the coronavirus variants and bring them to the family members who are more vulnerable to get the infection, and they may be at a risk of getting these coronavirus variants even though they had vaccination. So let's think about that. That brings us to the point of avoiding large gatherings where the younger population may be exposed to the coronavirus variants. And so, ladies and gentlemen, you have been watching COVID-19 pandemic world news. I am Dr. NIK NIKAM from Houston, Texas. Please do subscribe to our YouTube channel. We have more than 80 videos covering the general knowledge about COVID vaccine on our YouTube channel. I also have a book, COVID-19 Pandemic, an International Guide. You can check that out on Amazon.com. And thank you so much for your time. We'll see you next